So when I see a colleague that appears to be under the influence of alcohol at work, we have to go back to the ethical foundation based on the code of conduct. A doctor must maintain high personal and professional standards. So practicing under the influence of alcohol or drugs is a serious misconduct and subject to disciplinary actions. This is because it can jeopardize patients' care and safety, and patient safety is the most important priority in our line of work. So, in our immediate, my immediate action, if seeing a patient, a colleague of mine who is under the influence of alcohol, we have to act immediately to ensure the patient's safety. We have to discreetly intervene to stop the colleague from continuing any clinical duties, and we have to try to arrange for another competent practitioner or doctor to take over. So when we are aware that this is occurring, we need to report the impaired colleague to the appropriate higher authority, which is usually a supervisor or the department head, based on our factual observations. Practitioners or doctors have an ethical duty to report colleagues whose impairment endangers patients even without their consent. So that is our short-term actions that can be done. In terms of the long term, it usually is beyond our scope. It usually involves a preliminary investigation committee with further action from the disciplinary board, with a potential referral to the fitness to practice committee for assessment. So since the nature of his transgression involves alcohol use, this might include both disciplinary action but as well any supportive rehabilitation for the doctor in question. So just an overview of the ethical principles that are involved is usually patient safety, which is always a top priority, personal integrity, upholding honesty and dignity of the profession, as well as the duty to report, overriding interpersonal discomfort and confidentiality, as well as accountability, as being aware of the situation but failing to act can have consequences on the reporting doctor. So of course there's a lot of challenges that can go through this, such as emotional discomfort, fear of retaliation, difficulty in confirming impairment without any evidence or testing, as well as general concern for the colleagues' well-being. However, despite all these challenges, inaction may compromise patient care and may breach professional duties. So based on the codes of conduct, it makes it clear that protecting patient from impaired practitioner is a non-negotiable ethical obligation that requires immediate action.